Good evening, students. I am Dr. Divya Asnani, and I will be discussing dermatology questions with you. So let's begin with the first question. A patient presents with focal hair loss accompanied with pruritus and scaling. So here, pruritus and scalp scaling are the main cues, and these two symptoms point towards a fungal infection of the scalp. And therefore, it rules out the top three options for us, and the right answer being oral antifungals here. Moving on to the next question. A patient is found to have dark black lesion on the plantar surface of the foot. What is the most appropriate investigation? Most appropriate investigation out of the four would be skin biopsy, as KOH mount, gram smear, and Zank smear, all of them are superficial smears. So while all of them also can be done, a skin biopsy gives the full thickness analysis of the lesion. So that is why the most correct out of the given options would be skin biopsy here. During tattooing, which layer of the skin pigment or ink is primarily deposited? This is a straightforward question. The answer here is dermis. During tattooing, the pigment finally goes and settles down in the dermis. It does not go in the epidermis, subcutaneous tissue, or the muscle and vasculature tissue. Next one. Match each of the clinical sign in column A with its corresponding dermatological condition in column B. So let's see what's happening here. So positive Nikolsky sign is characteristic of pemphigus vulgaris. So this is when tangential pressure is applied on the skin, you can see the shearing of the epidermis. Pseudo-Nikolsky is seen in Steven-Johnson syndrome, which is due to epidermal necrolysis and not due to the DSG desmogleins playing a role in pemphigus vulgaris. False Nikolsky is seen in bullous pemphigoid. Here, false Nikolsky, a type of, as Hansen's is a type of false Nikolsky, you can see the separation because of the moving of the fluid. And cerebriform tongue is a characteristic histopathological pattern of pemphigus vegetans. So, yes, moving on to the next one. An infant presents with pruritic lesion distributed over hands, feet, and periumbilical region. So here the clues are firstly the age group, which is the infant. Pruritic meaning itchy, hands, feet, and periumbilical region. So bullous impetigo mainly around the oral cavity, honeycomb crusted lesion. Atopic dermatitis, they should have mentioned some sort of clue in flexures. Periumbilical region is also a main clue. KBs here seems like the most likely option because periumbilical being one of the clues, and in infants, hands and feet are also involved. Eczema can present anywhere over the body. So the regions given particularly here don't make sense in case of eczema. So that is why infant, hand, feet, periumbilical region and pruritic lesion mainly point towards scabies in this case. Moving on to the next question. A female presents with greenish frothy discharge. Whiff's test and Amsel's criteria are negative. So I hope everybody has carefully read the question. So Whiff's test and Amsel's criteria here are negative. So that is why it is not bacterial vaginosis. Greenish frothy discharge indicates Trichomonas vaginalis, and Trichomonas vaginalis are motile flagellates. Hence, the answer here is motile flagellates. Moving on to the next one. A male patient reports painful vesicular eruption on the penis. So the clue here is the vesicular eruption. Haemophilus ducrei, human papillomavirus, and Treponema pallidum, all of these do not present as vesicles. Painful vesicular eruptions is the classic clue for herpes simplex virus infection. So the answer would be herpes simplex viral infection in this case. Next and the last question. A newborn presents with a skin lesion as shown. The feeding is normal, has no fever, hypotension, shock, which is the most likely diagnosis. So the clue here is the patient has none of these systemic features, all right? So bullous pemphigoid mostly presents in older age group. Neonatal pemphigus due to transplacental antibody transfer is the answer here. Why? Because staphylococcal scalded skin syndrome and epidermolysis bullosa, the child presents with systemic features like fever, hypotension, shock like symptoms. Neonatal pemphigus due to maternal transfer of antibody is a very transient condition that happens in neonates, and with age it gets better. So the answer here would be D. Thank you so much. I hope all the questions and the explanations were clear.